name is Ifeyemi Andrew. Doctors of the Federal Republic of Nigeria issued the federal government a 21-day ultimatum. This ultimatum was issued sometime in July 2 this year. They issued the ultimatum saying to the federal government to meet its demands in order to avert an industrial action in the health sector. Now, there was an interview that was had with the president of the NMA, Bala Audu, and he was trying to put in proper perspective the reasons why that ultimatum was issued and what some of the demands are that doctors are making. And some of these include the issues in the healthcare sector. Delivery in manpower is intensive, and it is also physician driven. And so he says the health workforce needs to be taken care of to enable it rededicate itself to delivering that service at the highest level. So if they must deliver quality health care, there are a lot of things that the government needs to international practices with regards to how many patients to a doctor, even the country, is with regards to how many patients to a doctor, even the country, and going out to seek greener pasture. It was a job trying to put in policies to stop doctors from leaving the country. That was met with stiff resistance, if you remember. The quality and best care for Nigerians. This is something that was also said by the national chairman of the NMA. This morning on the show, we are going to speak of the NMA. This morning on the show, we are going to speak with the NMA chairman in Rivers State. He will be joining us. And NMA chairman in Rivers State, he will be joining us in the studio. But before I get over to him, the federal government had a recent circular that was issued by the National Salaries, Income and Wages Commission that was supposed to review the allowances of medical and dental officers in the federal public service. Now, it's very controversial because the circular was dated June 27, 2025, with reference number S. Issued is of whether in the time of this ultimatum, any meetings have been held. For you who's listening, the first question is, this strike that may happen, emphasis on may, would you support it? Would you support the doctors embarking on this? It would bring about positive change. 808-93007 and also call 08 923 0002 0817 923 0002. On Facebook, we are live at Nigeria Info 92.3 PH. That's our Facebook handle. So get on Facebook, like the page, and join in on the conversation. Again, on Facebook at Nigeria Info 92.3 PH. That's the handle. The numbers to call are 08 17 923 230007. You can also call 0817 923 0002. The WhatsApp number is 0809 030 6416 0809 030. The strike is sure to bring about positive changes in the health sector. Let's go to Rumokuta and start there with Chima. Good morning.
Good morning, my brother, Mr. Etienne. I will not support them because we should not continue to be portraying our nation in a back light. Now, the issue is that now, if you go on strike knowing the kind of duty you owe to humanity, who are you affecting? The elite is going to a foreign country for their treatment. And you and I that came from the same society, same background, you are urging them to suffer us. That's the thing. And this isn't the first time that these medical doctors they have been indulged in this industrial law. What did you hear now? Now, let me tell you something. Now we're talking about the speculation concerning pensioners who were civil servants. Now tell me, do you believe with me that these politicians cannot do anything as in siphon Nigerian currency or money from the government without the aid of the civil servants? Do you believe that? That even the governor of a state or the president cannot spend money from treasury without a civil servant go and check it. So all these things, if you look at it very well, it is them that are civil servants that are causing us all these problems that we are having now. All these problems we are having. Let them not go any strike. Although let them be persuading the government to say they can maybe enhance their salary or equip the hospitals. But this strike, they shouldn't go because they go, it's going to affect me. I don't like it. My name is Chima Dike for Mokuta.
All right, Chima. He says if they go, it would affect him, and he doesn't like it. But then again, there's the argument that the only thing the government understands in this country is strike. On Facebook, Eugene Genesis says, I will fully support it. That's on Facebook from Eugene. He says, I will fully support it. That's referring to the strike. Now, amongst their demands, several other things I'd like to highlight. And so we take a critical look at it. We also have the problem of costs for medicine, cost for to even access health care. It's on the rise. It's on the rise. And if a strike would address some of these problems, well, where do you stand on it? Muriel in Okrika, good morning.
Thank you. Ifemi, good morning.
Yes.
This is Okrika woman. Ifemi, I don't know if you took the headline that states that the federal government spent almost
circular, yes, for
dollars on Buhari's health or during his tenure.
Okay, no. We didn't take that. Go on.
Okay, you did not, but it was in one of the papers.
Yeah.
Look, Ifemi, if federal government has invested that money, and that was just for Buhari, not to talk of others. Now, let's just concentrate on Buhari. We have invested that on just only 2 or 1 federal hospital. Imagine what we'll be getting. Now, these doctors are not, sometimes we look at it and say, let's leave politics aside. If you go to government hospitals, you hear me, and maybe you are just attending to your relative that is there, taking care of your relatives. Oh, my God. We're not talking of the stress alone. If you see the mosquitoes, to get mosquito nets is a problem. Good beds are a problem. Some persons, lack of bed, they will just, some persons will sit on the chair after operation. Did you know? Some persons don't even visit these places and they just start, don't go. For lack of bed, after surgery, they will have to remove you or just allow you to just, or give it something to maybe bounce back a bit, and then you just move a bit for incoming people. There are more that are coming. No bed space. What about light? Do you know that someone went to the hospital, the bone center, and because of light, issue of light, this man, because he was a billionaire, he has money, he has to do small solar. Just donate that to the hospital. People are donating to hospitals. If you see what Nigerians are suffering in federal hospitals, and then you say they should not go to site, they should not go on site. This thing they are doing for us, these doctors can be able to travel and they can leave. So many of their colleagues have left, but they are here because of the love for the state. It's not as if they don't have opportunity. These people have opportunity to leave because they are rushing them all over the world. These people are very, one of the most intelligent people we have in this country, and yet it's subjected to this kind of environment. Just small things they're asking, and you will not give them. Yet you fly out. Yet your children will take off and go and do whatever because we have the money. We are the ones that are suffering. So we should know that they are doing this for us, not for the politicians or not for their own, because they can be able to go out. They can afford it. They can take off. They can do anything they want. They can afford private hospitals. But they are doing this for us for government hospitals.
All right, Muriel, thank you. Good news. Good morning.
Good morning, my brother, man. How are you this morning?
Fantastic. Go on.
It's very unfortunate that the same talk will come next year and repeat it again. This same issue was repeated 2 years ago, repeated under the regime of Muhammad Buhari, repeated under the regime of Jonathan. It was in the time of Yar'Adua we didn't hear it. I think Obasanjo, when he was the president, did very well by building good hospitals in the 6th geopolitical zone, UPTH inclusive. After the building and equipping it, sustenance became the problem. Serious problem. Settling of doctors became problem. Look at states, except Amechi and who I don't know. that try to make sure that they reduce they bring down health centers in the localities so that people who have minor sicknesses can go to health centers. Major can be rushed to the hospitals. But after that, he placed 400. We are all aware. It's something we are aware of. But after that, everything deteriorated when he left. When you look at UPTH, I was UPTH last week. My brother, the place is something else. And we have people in government with our own money that has what that could fix it. That I think I see lack of patriotism. They don't have country. They only want to lead them, carry the ego up. If not, even Taure from Burkina Faso has not left his own country to another country to treat himself. But you see our own leaders here, smarting, they run away. And yet they don't want our doctors to live. I think I see it as lack of patriotism in the lives of the leadership. God help us. My name is Chris from Port Harcourt.
All right, good news. Thank you. Later, Barry from Bori. Good morning.
Good morning, Ifeanyi Andrew.
All right, let's hear you, please.
Yeah, mine is just an advice to the government. I think, as far as I know, we are all human, and blood runs into our veins. I think if you consider first, I think doctors are not supposed to be seen as inferior people or people who are not taken serious in our society based on the responsibility they handle. I want to call on the government, please, whatever it takes, please see into their problem and see how you can consider them. What if there is anything that is bringing arguments between the government and the doctors? They should be able to sit down and see how they can do the arithmetic in order to solving this problem. Please, I want to beg either state and the federal government to look into the welfare of the doctors. It will be good because it will be good to our people because they handle the problems regarding to our parents.
All right, Litan
It
Barry.
might not be you directly. It might be your brother, my sister, relatives who might have health challenges in one way or the other. Please, I want to beg the government to.
All right, thank you, Litan Barry. Unfortunately, we had to interrupt you there. We have a commercial coming. My guest is with us in the studio, Dr. Tamunokuro. Sir, thank you for joining us and good morning.
Good morning.
I believe you owe us plenty of apology.
Good morning, Ifeanyi. Good morning, listeners. Apology for coming late.
I've forgiven you. I don't know about them. Maybe after the break, we'll find out whether they have forgiven you. But regardless, you're here now. We have a short commercial coming. So as soon as we return from that, we're going to hopefully get details into the situation. What we're hearing is there's a circular that came out and the government is saying it didn't put that out. We've heard the national chairman of the NMA talk about it. I would also find out from you. Some people think doctors shouldn't go on strike because they owe a service to humanity. How do we balance this? The doctors are also human beings, and then they also need to be taken care of. And he who is working should get what is due him. So how do we strike the balance? What are these demands that you have that the federal government is yet to respond to? And in the course of this ultimatum, has there been meetings with the federal government? Have there been conversations, discussions? All of this we'll find out when we return after the break. In the meantime, on WhatsApp, it is 0809-030-6416. Will you support a strike if a strike by doctors would bring about some change in the health sector? Let us know what your thoughts are. We'll take more after we return from this short commercial.
Station on radio without feedbacks from you, the listener. As your number one station for talk, we pride
ourselves in not just having engaging conversations that will enlighten, inform, educate, and sometimes even entertain you. From social issues, politics, business, or the stories making the headlines, we make you the center of those conversations by getting your thoughts and opinions too. We would love to hear from you. Be a part of our conversations in Nigeria Info FM Port Harcourt and share your views via the following outlets. Call us live on 0817 923 0002, 0817 923 0003, and 0817 923 0007. Or drop a message for us at Nigeria Info PH on X and at Nigeria Info 92.3 PH on Facebook. Ensure to always be civil and keep your conversations in tandem with the ongoing discussion. Also try to be brief and straight to the point so other contributors and contributions can also be accommodated. Nigeria Info FM. Real people, real conversations. Let's talk. What is a conversation on radio without feedbacks from you, the listener? As your number one station for talk, we pride ourselves in not just having engaging conversations that will enlighten, inform, educate, and sometimes even entertain you. From social issues, politics, business, or the stories making the headlines, we make you the center of those conversations by getting your thoughts and opinions too. We would love to hear from you. Be a part of our conversations in Nigeria Info FM Port Harcourt and share your views via the following outlets. Call us live on 0817 923 0002, 0817 923 0003, and 0817 923 0007. Or drop a message for us at Nigeria Info PH on X and at Nigeria Info 92.3 PH on Facebook. Ensure to always be civil and keep your conversations in tandem with the ongoing discussion. Also try to be brief and straight to the point so other contributors and contributions can also be accommodated. Nigeria Info FM. Real people, real conversations. Let's talk. What is a conversation on radio without feedbacks from you, the listener? As your number one station for talk, we pride ourselves in not just having engaging conversations that will enlighten, inform, educate, and sometimes even entertain you. From social issues, politics, business, or the stories making the headlines, we make you the center of those conversations by getting your thoughts and opinions too. We would love to hear from you. Be a part of our conversations in Nigeria Info FM Port Harcourt and share your views via the following outlets. Call us live on 0817 923 0002, 0817 923 0003, and 0817 923 0007. Or drop a message for us at Nigeria Info PH on X and at Nigeria Info 92.3 PH on Facebook. Ensure to always be civil and keep your conversations in tandem with the ongoing discussion. Also try to be brief and straight to the point so other contributors and contributions can also be accommodated. Nigeria Info FM. Real people, real conversations. Let's talk. What is a conversation on radio without feedbacks from you, the listener? As your number one station for talk, we pride ourselves in not just having engaging conversations that will enlighten, inform, educate, and sometimes even entertain you. From social issues, politics, business, or the stories making the headlines, we make you the center of those conversations by getting your thoughts and opinions too. We would love to hear from you. Be a part of our conversations in Nigeria Info FM Port Harcourt and share your views via the following outlets. Call us live on 0817 923 0002, 0817 923 0003 and 0817-923-0007. Or drop a message for us at Nigeria Info PH on X and at Nigeria Info 92.3 PH on Facebook. Ensure to always be civil and keep your conversations in tandem with the ongoing discussion. Also try to be brief and straight to the point so other contributors and contributions can also be accommodated. Nigeria Info FM. Real people, real conversations. Let's talk. What is a conversation on radio without feedbacks from you, the listener? As your number one station for talk, we pride ourselves in not just having engaging conversations that will enlighten, inform, educate, and sometimes even entertain you. From social issues, politics, business, or the stories making the headlines, we make you the center of those conversations by getting your thoughts and opinions too. We would love to hear from you. Be a part of our conversations in Nigeria Info FM Port Harcourt and share your views via the following outlets. Call us live on 0817-923-0002, 0817-923-0003, and 0817-923-0007. Or drop a message for us at Nigeria Info PH on X and at Nigeria Info 92.3 PH on Facebook. Ensure to always be civil and keep your conversations in tandem with the ongoing discussion. Also try to be brief and straight to the point so other contributors and contributions can also be accommodated. Nigeria Info FM. Real people, real conversations. Let's talk. What is a conversation on radio without feedbacks from you, the listener? As your number one station for talk, we pride ourselves in not just having engaging conversations that will enlighten, inform, educate, and sometimes even entertain you. From social issues, politics, business, or the stories making the headlines, we make you the center of those conversations by getting your thoughts and opinions too. We would love to hear from you. Be a part of our conversations in Nigeria Info FM Port Harcourt and share your views via the following outlets. Call us live on 0817-923-0002, 0817-923-0003, and 0817-923-0007. Or drop a message for us at Nigeria Info PH on X and at Nigeria Info 92.3 PH.
In the studio with us this morning is Dr. Tamunokuro, the chairman of the NMA in Rivers State. Sir, good morning and thank you for making out time to be with us.
Thank you, Femi. Good morning, Good morning, listeners.
Okay, let's just get to it because, we already exhausted most of the time. Why was the ultimatum issued in the first place, the 21-day ultimatum? Why did doctors issue the ultimatum to the federal government?
Let me start with this, FME. Fixing Nigeria's healthcare problem is not rocket science. There are three basic issues with the healthcare system in Nigeria. One is health financing. The second is health infrastructure. And the third one is having a well-motivated workers. And that's where the ultimatum comes in. So, agreement between the NMA and the government, several agreements anyway. The last being in 2014, a collective bargaining agreement where certain rates were agreed and then periods were set for review. And on the 27th of June this year, the National Income Wages and Salaries Commission brought out a notice of what they call the review of the salaries of health professionals in the Federal Civil Service. And by the time we saw that review, we realized that the problem of this country and of the healthcare of this country truly is the government and the people that say they are there to serve us. Clearly, there's an intention to collapse the health system and to make sure that the doctors that have decided to remain in this country to serve this country are not motivated to serve at all. So the circular goes clearly against what was agreed between the enemy and the government. And the enemy drew government's attention to this, that look, this circular is clearly against our previous agreements. And of course, in the usual style, government wasn't even ready to listen. This was what generated the 21-day notice or ultimatum that was given by the national emir to the government.
So in the course of these 21 days that the ultimatum has been on, and it's supposed to be exhausted tomorrow, if I'm not mistaken?
That's correct.
Has there been any communication between NMA and the government?
So between day 1 and day 10, there was absolutely no communication. From day 10 to the 20, when different state chairmen started bringing out their own press releases, rejecting the circular, government made an attempt to meet with the enemy, but of course those meetings didn't produce anything.
So I'm guessing now the government is saying, well, we are trying to meet you now, so why don't you guys just hold on so that we finalize?
Now the enemy has fixed an emergency delegates meeting, and government is worried about the outcome of that meeting. And that was the reason why government brought out a circular yesterday to suspend the previous circular from the National Salaries, Income and Wages Commission. But we know government style. This is just government.
So why did the question would be, why didn't the government do this? Because that circular came June 2. June in the month of June 27th.
Yes.
And then they didn't say anything about it until now that the ultimatum is almost ending. And then they're saying this. It wouldn't send the right signal. But beyond this is the question of how then, if doctors eventually decide to go on this strike at the end, how are we going to manage that and also at the same time manage patients across the hospitals in the country that will be affected?
It's going to be a very terrible situation, I must tell you, Femi, because already currently our health facilities are not functioning optimally. You realize many of our doctors are leaving the country. Just last month, we are told that 5,000 resident doctors abandoned their training and left the country. Now, these are just resident doctors. This country doesn't have up to 40,000 doctors, facing more than 200 million people. Now, what about the specialists and the other doctors that have left? So the doctors that are left behind are just being patriotic and trying to do the best in the midst of a very poor working condition. And then the little that government should do to motivate them, to retain them, and perhaps to attract more people to come to the Nigeria's health sector. Government is clearly unwilling to do that. So it shows insensitivity on the side of government, a desire to collapse the system, and a deliberate attempt to make sure you and I, the poor people, the common people on the streets of this country, do not even have access to the healthcare that we are supposed to have access to.
You made mention of doctors migrating, and about 5,000 resident doctors, you say, in the past month?
Yes.
Have migrated to other countries. That brings me to also ask this question. I know that bothers the NMA, of course, but then there's also the increasing cost of access to healthcare. The price to access healthcare, quality healthcare, is also on the rise. The cost of medicine is also on the rise.
That's right.
Is this a concern to the NMA, and how can we go around this? Because it's also encouraging quackery in the sector.
That's why I mentioned there are 3 basic problems. See, the problems of healthcare in this country, solving them is not rocket science, really. Health financing. If you want to improve the quality of health in this country, you must have universal health coverage. People must have access to healthcare at any time, quality healthcare, without paying from their pockets. Healthcare is not a commodity you decide to pay from your pocket, because you'll be able to pay for quality healthcare. So you must have health insurance for all citizens, regardless of age or tribe or wherever they work, whether you're in the formal sector or informal sector, whether you're working for government, even if you're a privately business person, you must have access to healthcare. That's key. That's the only way health quality in this country can improve. And then there must be an attempt to improve on the health infrastructure that we have. If you have that and you have a workforce that's motivated, health in this country will certainly improve. And that's basically what is lacking in this country. The moment you have a government that is ready to deliver on health insurance, on health infrastructure, and motivate the health workers that are in this country to be able to retain them and attract more people, there's no way health quality will not improve in this country. So you and I can walk to the hospital and have treatment, and we don't have to pay a dime because we've already paid from our salaries. And in sane climes, this is what you have. You can go and have surgeries, heart transplant surgeries, knee replacement surgeries without paying from your pocket because it's been covered by your insurance. But here, you realize the level of health insurance coverage is still very low. Many people in the informal sector are not covered. So someone comes to the hospital with an emergency, then he has to go and buy medications. Who plans for emergencies? No one does. It happens to everybody without any plan. So the system must have a plan to take care of emergencies when they happen, before the emergencies happen. So that's what we are lacking.
What's happening now? Do you see more doctors leaving the country?
Absolutely. You see, Nigerian doctors are one of the best trained in the world. Quote me anywhere. And that's why wherever Nigerian doctors appear, people want to retain them. Because the quality of medical training in this country is what many countries are trying to emulate.
But that's the argument that the government made under the last administration. Say, we can't give you this knowledge, train you here in this country, and then you take the knowledge and you don't even serve or impute anything into the country, then you
must do something to retain that person and to motivate that person. You can't, no one is in prison. You can't keep someone here. If his services are needed somewhere else and is going to be rewarded better in those places, he's going to move there. I mean, what are health workers asking for? That pay should be better than what it is today. That the average Nigerian doctor is being paid less than $200 a month compared to other countries. In countries like Tanzania, for instance, the doctors are getting close to $1,000. In South Africa, they get up to $8,000 in a month. But in this country, even in Ghana, a neighboring country, they get more than $1,200. But in this country, you see what the doctors are getting. So you realize the average doctor is not willing to continue to render his services. The medical students, those younger ones coming behind us, are not motivated to even stay in the system because they are seeing places where their services will be better appreciated, where security is better, where basic infrastructure is available. So they'll tend to move over there. So these things are not big issues, but we see a government that is not truly sincere to fix any aspect of this country, including healthcare. And that's really sad. And that's where we find ourselves.
All right, we'll go to the phone lines in Matter Movement. I'm sure a lot of people have questions that they want to ask, but let me throw this one to you before I take some calls. How is the NMA looking at the problem of quackery? We've had news of people operating hospitals illegally that are not registered. We've seen doctors carrying out procedures that they are not qualified for. They don't have the certification to do, and they do it. And I mean, the excuse for many people is it's cheaper, so they have to go patronize those people. And in many neighborhoods, you have these people doing these sort of things. And well, in some cases, I'll blame the people who are not reporting, but then back to what I said earlier, they would say this is the one they can afford, so why would they then go report it and so on? So how do we go about the problem of quackery?
So I'm happy you asked this question. When we came on board, we noticed that the key issue, one of the key issues in healthcare in Rivers State is the issue of quackery. We set up the anti-quackery committee, and we're happy the Ministry of Health in the state also supported it. Today, I must tell you, Femi, that the anti-quackery committee is very busy in Rivers State, and I'm happy many people are beginning to see what we are doing in the anti-quackery committee. If you see any health facility that is operating below standard, you can report to the enemy.
How can they know a health facility that is approved how can people know the health facility that's of standard?
It's very simple. And I tell you, many people come to us to report to us. Every month, we get reports from the public of suspicious activities in some health facilities. And we get down there and we close them down immediately. Because we realize many of these facilities are not even registered with the State Ministry of Health. So the moment we hear those things, we get there, we investigate, and when we find out that you are not fully registered, or you're registered but you're not operating within the limits of where you're supposed to operate. For example, you run a maternity, you have no business doing surgeries in that place. Maternities are there to take care of uncomplicated pregnancies. The moment you see red flags in monitoring labor, you refer that patient to where cesarean section can take place. You run a clinic, for instance. There are certain aspects of health services you're not expected to do. So the moment we notice that that facility is going to be closed down and that person involved is going to be prosecuted. 2 months ago, we prosecuted a person who claimed he was a doctor, yet he wasn't a doctor. So we urge members of the public, if you notice such things, report to the association and we will take the necessary steps. The health of Rivers people is paramount to us. We want to make sure that the health care you're receiving, it's genuine. You know, you're seeing the right kind of health workers.
Yeah, the health care of Rivers people are paramount. And please, that's why they are saying don't go on strike. Because it will then affect the health of Rivers people when they need your service.
But this is clearly a national issue, so we handle it at a national level.
All right, 0817-923-0007, 0817-923-0002. Again, 0817-923-0007, 0817-923-0002. We'll see if we can take 2 to 3 calls and then wrap things up. It's laughable that government gives jobs to NMA or doctors that are giving the job back to Nigerians that are ignorant about their job. We are in a serious trouble. I wish I could understand what you're trying to say, my friend Ogojono Justice. You sent that message. Magnus from our 3, let's hear you. Good morning.
Thank you so much, Mr. Andrew.
Yes.
And greeting to your guest. Like your guest said, the health of Rivers people is paramount and should remain so. I see a problem in this sector. The problem that the NLC is having in this country is also the problem that the organization is having. Division. You see some of the heads are collaborating with government to sabotage the system. Andrew, if you go to BMH, these days I was opportune to be in BMH for 2-3 weeks now. You see what doctors and nurses are suffering in BMH. It is not supposed to be so. Why won't they leave when they have learned enough and they need a better environment to showcase what they have learned and the opportunities are not there? What do you want them to do? I still return the blame to the government and the leadership of NMA because they need to do more. The level of sabotage in the system is much. And so until we check from in-house, we need to come out to talk. We must check the administration.
All right. Thank you.
From there. Thank you so much.
Thank you, Magnus. So basically saying we have some doctors becoming politicians or working with politicians as politicians. We'll get your response. I know you're eager to say something, but let's hear from Ida and then we go to Justice. Ida, let's hear you first.
Good morning.
Yes.
I greet your guest in the studio. I send you one video, please, after I play the video to your guest. And I want to plead with the federal government and the state government to equip our hospitals. Go to teaching hospital. Now, if you go with malaria, you come back with typhoid. The rate of mosquito there, my brother, is too much. Federal government and the state government should equip the hospitals. Then they build hospital for the hotel. Look at the airbill, I want to travel to go and treat yourself. When you build hospital, go there and test yourself first. Before that, go there. The way they are eating our money, traveling out with our money is bad. They should equip all our hospitals. Please, come to Tamunokuro, there is no hospital. Before we drive down to Bori, maybe a pregnant woman, maybe she might. Please.
All right, Ida, thank you. And then Justice from Omudioga, quickly, as we wrap up. Good morning.
Andrew, good morning. My regards to your guest. Andrew, I listened to your guest analyzing the salaries of medical doctors in other countries.
hearing that alone makes me weep tears and pity doctors practicing in Nigeria. If his analysis of these salaries is correct, it means that doctors in Nigeria are earning peanuts. We just stipend, no salaries. Please, government needs to do something about it. And my plea to them is that while negotiating with government, we should also put into consideration the dilapidating facilities in Nigeria. Our health centers, factories, hospitals are not up to standard. Please, we should consider them just like in my community, Omudioga. Andrew, our health center cannot attend to anybody. Please, thank you, Andrew.
All right, Justice, thank you. Dr. Diamond, you heard the callers, which brings me to the first question I was asking about how, when the caller said about the division and the some of the leadership at the high level romancing with politicians, and so it's difficult to implement certain things that should be in place. Is that the case? Do you also see that we're having too much politics now and having doctors now more involved with politicians and not putting these important things first?
Well, there are doctors that are administrators. There's no doubt about that. We don't see much of divisions in the profession, quite clearly. An administrator would first protect his interest, the interest of the place that he serves. We understand that. But when we make demands as enemy, we make it collectively. These demands you're seeing are directed at the federal government. We are happy that the Minister of Health is cooperating. Like I told you, a circular has been released to suspend the initial circular, which for us is initial progress. We hope that government will do more. Our demands clearly are not based on doctor salaries alone.
So can you highlight?
There are lots of there are set 17-point demands. Infrastructure is key, and I'm happy many of their callers are talking about infrastructure. We need the health infrastructure of this country to be better. People must have access to quality health care. For God's sake, there is no reason why in this country in 2025 someone would not be able to have access to quality healthcare wherever he lives as a Nigerian. And it's sad when you note that in some communities, you don't even have a health center.
Sorry to interrupt you. This person says that apart from government's failure, the head of hospitals are also to blame. For example, UPTH, all the funds the government are releasing, what are they using it for? I'm tempted to say it's being siphoned. So that these CMDs live large like governors. Now, CMDs in the past have come under fire. People have questioned how they utilize funds. Money is generated and money sent there. Because when you visit, as much as they always say what people are saying is not true, I've had experiences there. I have gone there myself. I've had family members, friends who have been there. Many others will tell you what they experience, and it's nothing close to standard, which then questions, okay, you're a doctor, you said that the government is okay, the little one that you are empowered to do, we are not seeing you do it. So how do you respond to that?
So, well, the quality of healthcare, it's far below where it should be. We've all said the same thing. I know there are their own challenges that they face, but I'm not yet to speak brief for heads of hospitals. But I know that the peculiarities of funding the hospitals is a key problem all over the country. I must tell you. You should ask yourself why many of our teaching hospitals are trying to see how they can improve on the quality of health services. It's because funding has become a problem, a huge problem. And with the increase in the price of diesel and electricity tariff, you realize even sustaining 24 hours power in hospitals is becoming a serious challenge. And just recently, the NMA mentioned the issue of giving rebates to hospitals in terms of electricity, because you can't run a hospital when there's no steady electricity. Many of the things we use depend on power, and you can't give hospital the same rate you give to other sectors, because you're talking about life here. So those are the key issues, and then if you now combine this with the earlier problems of health financing that was mentioned, you realize that these little issues, if we can have a government that is committed to solving, even if you solve one at a time, one every year, in the next 4 or 5 years, our health system is going to improve.
All right, Dr. Diamond, unfortunately, that's how much we can take. Thank you for your time. We hope to do this again in the future. And let's wait and see whether you decide to embark on that strike or not. My name is Ifeami Andrew. Good morning. Stay tuned. Hello, Port Harcourt with Jude is next. Good morning.